Hello, how are you today?
Good, thanks.
Good. Well, today I've asked you to come in to just go over some basic oral hygiene instructions. Just before we begin, I know we did your medical history for the last little video I did. No major changes to that.
Nope.
Still taking your vitamins and your probiotic daily.
Yep.
Perfect. And we said no significant changes. So let's get started. So how often do you brush your teeth a day?
Twice a day.
Twice a day. And then floss?
Once a day.
Good. So you're right on track for the recommended ideas from the ADA. So first I want to talk about the importance of brushing and why we do it. The reason we brush our teeth is to help remove that food or that plaque. And plaque is that sticky white substance or film that forms on our teeth which contains bacteria. The increase in that bacteria in our mouth, which is caused by plaque, can increase the acidity in the mouth. And that increased acidity can cause the hard tissues in our mouth, such as our enamel or our dentin, to break down. And then the breakdown of these materials causes tooth decay, and severe decay or cavities or caries can cause a variety of oral health issues such as gingivitis, periodontitis, which are those inflammations to the tissues or the gums. And then we can also lead to things such as dry mouth or bad breath, which most people definitely don't want. Brushing is not the only way that we can clean our teeth. Flossing is used as well to help remove plaque from those spaces in our teeth, or those proximal spaces which we cannot reach with our toothbrush. So now, this is why we brush. So now I'm going to show you a little bit of how to brush and floss, and we're actually going to look at how your technique is overall. So I'm going to have you just take a little sip of this and just rinse for about 30 seconds, just swish in your mouth there. Then you can just spit it back in the cup. If you want to do it off camera, you can. And this is it's called a disclosing agent. This will show us the areas of your mouth that contain a lot of plaque, or areas that we need to continue working on brushing more. You're probably good. And then I would run some water too, just so you can, otherwise it'll stain. Okay, so if you look here on our little mirror, I'll show you. See kind of right on those anterior teeth, and then interproximally for sure. So we're definitely going to want to talk about flossing and making sure we get in there. But overall, that's really, really nice job. You're doing a very good job. So now we're just going to go over some basic techniques to make sure that, we can improve on those areas. If you want to rinse your mouth with water, you can too. So first I'm going to show you how to brush, the technique that we commonly use for brushing. This is called the modified Bass technique, and it is one of the most popular and commonly used techniques for adults with non-receding gums, and you seem to have very nice gum line, so we don't have to worry about that. And then you're going to want to use about a pea-sized drop of toothpaste, nothing more, nothing less, and making sure that we're spitting that out, not swallowing it. Mm-hmm. So this is a typodont. It's just a model of your teeth, and I'm going to show you how this technique works. So we're going to come in at a 45-degree angle right at the gum line, and we're going to just small wiping motions or circle-like motions for 3 to 5 strokes or so, just to make sure we're really getting it. And then the modified part of this technique is to just flick that toothbrush down to make sure we get those chewing surfaces or the occlusal areas of our teeth. And then I'll show you again here back on the molars. So we're going to come in at a 45-degree angle, 3 to 5 strokes, and then just flick down. Okay. And then if we're having trouble with our front teeth, or those lingual areas, so the areas towards our tongue, we can come in at a straight or a vertical angle, and do that same thing. Try and focus 45 degrees and then flick it down. Okay. All right, so I'll have you try that if you'd like, and I'll help you if you need to. Sorry, it's kind of awkward. Yep, and you can even tilt up your brush a little bit more to 45. You're perfect, just like that, and then flick it down. Nice. Okay. Good job. And then you can also focus on your tongue as well during this process. You're gonna want to go from back to front, just because we're pushing that bacteria from the back to the front. We don't want to mix it all and all that. And that can also help prevent that dry mouth and that bad breath as well. And then next we're going to talk about flossing. Flossing is the same technique pretty much for everyone. We recommend that you do use regular floss, because this way you can find a new clean piece of floss every time versus floss picks where you can't really clean off that plaque. So you're kind of just spreading it around, but it's always something is better than nothing. Mm-hmm. So this is how we would floss. This is about probably a little more than 18 inches of floss. And we're going to start and we're going to wrap it around our middle fingers like so. on both sides. Doesn't need to be a super tight wrap or anything, just enough so you get a good firm grip on it. And then we're going to grab here with our thumb and this finger right here. Excuse my wrap. Just like that, and hold. Losing a tooth. And then we're going to start, excuse me, this is kind of an awkward angle. We're going to start, I'll show you. So you're going to start holding it like this, and then you're going to insert it in between your teeth, like so. I'm just going to do it like that. And then right when you get in between your teeth, you're going to fold it into a C shape, so you can really get in between those gums. Sorry, I'm kind of trying to hold too many things. And then once you get in between those gums, you're just going to move it in a seesaw-like motion, not too hard, because you don't want to bruise your gums or cause any excessive bleeding. And if you haven't flossed regularly in a while, you will notice some bleeding at first, just because your gums have to get used to that. And if there's excessive bleeding or you have any questions, of course you can call us and we will help you if we can. So I'm going to have you go ahead and try that for me if you can. Around your middle fingers, there you go. And I'll hold it for you because it's kind of an awkward angle. And then get it in between your teeth, form that C shape. There you go. And you can even get up around those gums a little bit more like that. Perfect. You can try one more. Yes, go ahead. And then I forgot to mention this, actually, so that's mine. But when you do that, you're going to want to make sure you move to a clean piece of floss before each. That was my fault. Yep. Just so we don't, again, spread that bacteria around the mouth. So you did a great job. And do you have any other questions about brushing or oral health?
I don't think so.
You're doing a really great job keeping that up twice a day. Flossing as often as you can really is important because those interproximal, or those areas between our teeth, is where those diseases first occur, or the root of all those periodontal diseases, excuse me, can happen. So just keep it up. Like I said, if you have any questions, please feel free to reach out, and we will be so happy to help you. And then I have a little goodie bag for you just to take home and practice, and there should be toothpaste, and if you want some more of that discoloring agent, it's in there as well. That just shows again where you missed brushing, but like I said, you're doing a really nice job. So thank you so much for coming today. I'm glad we could do it.
Thank you.
Yes, have a good day.